Vitamin B3, or niacin, has long been associated with cholesterol management, but its role in cardiovascular health goes far beyond tweaking lab results. Yes, niacin can raise HDL, the so-called good cholesterol, and lower triglycerides, which is impressive in itself. But the real beauty of niacin is in its cellular-level effects that influence vascular function, arterial repair, and inflammation control. It's not just about cholesterol numbers. It's about how well your blood vessels function, how calm your immune system stays, and how resilient your cardiovascular system remains under pressure. Let's start with the headline. Niacin is one of the few substances known to significantly raise HDL cholesterol. While statins and other lipid-lowering drugs focus on reducing LDL, bad cholesterol, niacin has a unique ability to increase HDL levels, sometimes by 15 to 35%. HDL plays a crucial role in reverse cholesterol transport, a process where cholesterol is pulled out of the arteries and sent back to the liver for excretion. The higher your HDL, the more efficiently this cleanup crew operates. That's like sending in extra garbage trucks to clear out the streets and keep traffic, aka blood flow, moving smoothly. Niacin also reduces triglycerides, the circulating fats in your bloodstream that, when elevated, can contribute to atherosclerosis and increase the risk of heart attacks. It does this by inhibiting the release of free fatty acids from fat stores and reducing the liver's synthesis of VLDL, very low-density lipoproteins, the precursors to LDL. The result is a measurable improvement in lipid profiles, lower triglycerides, higher HDL, and, in some cases, reduced LDL particle number. But while these lipid effects are well documented, niacin's cardiovascular benefits don't stop there. Niacin acts directly on endothelial cells, the thin layer lining your blood vessels, which play a critical role in regulating vascular tone and inflammation. By boosting NAD+ levels, niacin helps maintain endothelial integrity, supports nitric oxide production, which keeps vessels dilated and blood pressure regulated, and limits oxidative stress that would otherwise damage these delicate linings. In effect, it strengthens the vascular pipes that carry blood throughout the body, keeping them flexible, resilient, and less prone to the tiny injuries that can trigger plaque formation. Niacin also appears to have an anti-inflammatory influence at the immune cell level, particularly in monocytes and macrophages, two key players in the formation of atherosclerotic plaques. It binds to a receptor called GPR109A, found on immune cells and adipose tissue, triggering a cascade that suppresses the production of inflammatory cytokines. This not only reduces systemic inflammation but may help prevent the progression of existing plaques into unstable, rupture-prone lesions, the kind that can lead to heart attacks or strokes. Essentially, niacin helps keep the body from overreacting to cholesterol buildup, slowing the vicious cycle of inflammation and arterial damage. Interestingly, recent research has also pointed to niacin's role in cholesterol efflux, a process inside macrophages that prevents them from turning into foam cells, the hallmark of early atherosclerosis. Through activation of liver X receptor alpha, LXRA, and proteins like NPC1, niacin helps mobilize free cholesterol out of these immune cells, reducing the lipid burden inside plaques and supporting plaque stabilization, or even regression over time. That's a much more targeted effect than simply adjusting the cholesterol floating around in your bloodstream. Of course, high-dose niacin therapy isn't without controversy. While earlier clinical trials showed promise in reducing cardiovascular events, more recent studies in the statin era have failed to show additional benefits from niacin supplementation when statins are already being used. However, this doesn't negate the value of niacin in a broader physiological sense. Its ability to improve lipid profiles, support vessel health, and lower inflammation still matters, especially in individuals who are statin intolerant, have high triglycerides, or are looking to optimize metabolic health through more natural or integrative approaches. Even without high-dose supplementation, getting enough niacin through diet can support long-term cardiovascular resilience. Foods like tuna, salmon, chicken, turkey, legumes, whole grains, and peanuts provide both preformed niacin and tryptophan, which your body can convert into niacin. These foods are also rich in other heart-supportive nutrients, omega-3s, fiber, magnesium, that work in synergy with B3 to support arterial health. So yes, niacin is more than a cholesterol manager. It's a cardiovascular multitasker, modulating lipids, calming inflammation, protecting blood vessels, and powering the cellular machinery that keeps your heart pumping smoothly. Whether you're already on heart medications or just trying to age with grace and good circulation, niacin deserves a permanent place in your daily strategy for vascular health.